Dear viewers, we have been joined in the studio by Professor Milad Sami Bitar, a professor of pharmacology and therapeutics, Kuwait University, Faculty of Medicine, a consultant at Desman Diabetic Institute, and the Professor Fahd Mulla, a professor of genomic medicine, chief scientist officer at Desman Diabetes Institute. Of course, they're going to talk to us about this amazing invention that I can't wait for everyone to hear about. It's a pleasure to have you with us.
Thank you. Thank you.
To start off, Mr. Milad, what is the invention about? We talked about it under air, and I think it's something amazing. Can we talk about it?
Yeah, sure. I mean, basically, the invention started for the diagnosis and treatment of non-healing chronic wounds.
Yes.
And the problem there, obviously, what problems are we trying to solve? The problem that we have about 15 to 20% of diabetics may have non-healing chronic wounds.
Right.
And those faulty wounds are responsible for at least 80% of lower extremity amputation.
Right.
Now, speaking of costs, I will give an example in the USA. About $25 billion are spent annually in the treatment of non-healing chronic wounds.
Right, which is a really big number. It's
which
not
is really
something small.
Tremendous
Right.
cost for the health system. Now, what are the reasons for these non-healing wounds? One reason could be lack or decreased blood supply to the wounds.
Okay.
The second possibility is neuronal disturbances. The third possibility, overloading the wounds with bacteria. And the fourth and most important possibility, that the cells within the wounds become old prematurely or before their times.
Right. So there's definitely more than one reason that contributes
of course.
to that.
And the last one, it's very important because those cells which are responsible for repairing the wounds becoming very old, prematurely before their time.
Yes.
Those basically are reasons for non-healing chronic wounds.
Right.
Now, how do we go about treating non-healing chronic wounds? Current treatment, sometimes they use cleaning the wound with salts, solutions, debridement, meaning removing the dead tissue and inflamed tissue. The third approach is to use wound dressing, like you use biofilm, maybe hydrogel. So those are kind of wound dressing.
Yes.
And other approach may be to use oxygen therapy. And sometimes they may use pharmacological treatment, and we call that growth promoting polypeptide. It is a pharmacological compound. But most of them proven to be not very effective actually.
Right, because what I'm understanding, it's something that just gives you more time with the wound, more or less than actually treating it.
Yes, yes. And I think that's created a lot of problems, and patients obviously going through pain and suffering, and eventually, as I indicated before, they may have to go through amputation
of course,
lower extremity, and that's very painful to the patient and his or her family, obviously.
Physically and emotionally, of course.
Of course.
I've seen people go through that, and it's not an easy process.
No, obviously it's not. You know. So, what our invention will do? The new invention which we came with. This new invention, first and foremost, it can be given by mouth, and locally we can apply it on the wound. It can predict patients who are destined to have non-healing chronic wounds.
Amazing.
Before it happened, so preventive measure can be taken.
Of course. Yes.
Right? So that's one key advantage of our invention. The third advantage lies in the fact that it can prevent cells within the wound from becoming old. So they keep them younger much longer period of time. It can also provide those cells within the wound with very friendly and conducive environment, so they can work at their optimum in repairing the damaged tissue, or in repairing the wounds. And by doing so, actually, when we administer our pharmacological agents, when we administer it orally and we put it on the wound, we were able actually to not only increase blood supply to the wounds, but also restore sensation. So they start feeling now, whether it's hot or cold, they feel it now.
So you're basically bringing back someone's life in full capacity.
Exactly.
So we can say these are the problems that your patent does solve, or is there anything else we can add to the problems?
Actually, you know, when it does prevent those cells within the wound from becoming old and keep them younger for more period of time, those cells can start working very well in repairing the tissue. So now you are converting non-healing wounds into wounds which can go to heal.
Of course.
And this is really a good advancement in the treatment of wounds. And actually, if we can show one of the last pictures that we have.
Of course.
I want to add.
Yes.
I want to add an important point about the aging process. Once you become diabetic, the discovery was that you're actually prematurely aging. Not only your wound. A diabetic person.
We can say as a whole?
As a whole.
Yes, yes, of course.
As a whole. So the treatment also really is for anti-aging as well. So it has some really very important therapeutic and extra therapeutic effects as well.
Extra things.
Because when you are really restoring sensitivity or sensation, you are really correcting much of the neuronal disturbances, like neuropathy, diabetic neuropathy.
Of course, Professor Milad, and also now we have on the screen the photo that you asked for.
Yes, if
picture.
you see the first column, where you have a control normal patients, for example, or normal control subjects. If this normal control subject was subjected to wound or injury, what's going to happen after 1 week? With dressing of the wound, you are going to heal the wound by about 40%.
Okay.
Yes. When you put on the wound one of our component, then you will see that the wound get healed by more than 60 to 70%.
Yes.
So that's one component of our therapeutic regimen.
I think that's a really big deal.
Yes. That's under normal circumstances.
That's
so you are speeding up the healing of the wound.
Right.
Yeah.
You know. Now, if you look at the second column, it's not appearing now.
Yes, Control, can we just have the photo back on the screen to explain, of course, about the second steps?
Yes. If you see diabetic in subjects, after 1 week of injury, it hardly get healed by 20% or less.
That's true. And it could be like this forever, we could say.
Yes. And even if you add one component of our therapeutic regimen, still it's not very effective. One of the components.
Right.
Now, you look at the fourth column, when we add the second component of our therapeutic regimen, which we call it AUK, in addition to the first component of our therapeutic regimen, which is IGF-1, you can see the wound almost get healed by about 70 to 80%.
Okay.
Clearly indicating that this therapeutic regimens, which we came up with, can promote healing and convert non-healing wounds into wounds which can go to heal.
We're going to come back to that, of course, Professor Fahd and Milad, but we just need to go back to a fast break and we'll be right back. Dear viewers, we are back from this fast break and we're going to be continuing with Professor Milad Sami Bitar and Professor Fahd al-Mulla. Professor Fahd, can you talk to me about how many patents you do have?
Sure. So I'm really extremely privileged to be working with a real giant in the field, Professor Milad, my very close friend. We've spent about 15 years together in the same department, in different departments, and working out from day to night solutions to a problem. When you think about a patent, you don't think, I want to go and make a patent. You think, what is the problem?
Yes.
And how can I solve it?
Right.
Only then your idea is patentable. So over the 15 years, we worked out meticulously every single molecule in these pathways and huge networks. And for there, we developed around 6 patents on the subject. And we have 2 more patents in the pipeline pertaining to cancer and cancer metastases, because both are yin and yang, really. So we are in deep thought and deep discussion as well as to file another 2 additional patents. And we think the numbers are only going to grow up.
Of course. I think this is amazing, the work that you have done over the years. 15 years is a long time, but of course it's right enough time to get you this invention, which is amazing. Good luck on that, of course. Professor Milad, what are you going to do with the patent?
Well, now we finished most of our pharmacological and toxicological studies related to those patents.
Yes.
And now we are at the stage of setting up clinical trials, both at Desman Diabetes Institute and in the USA, to test our invention on diabetic patients who are suffering from non-healing chronic wounds or diabetic ulcers. And we had a number of pharmaceutical companies contacted us, which showed great interest in commercializing our invention internationally. So that's basically what we are after in the next maybe few years.
Yes.
Commercializing this invention hopefully will bring some light and help for many diabetic patients suffering from non-healing chronic ulcers.
Of course, this could be like very positive news to people that have been suffering for years and years with that. Mr. Fahd, can we talk about the invention and how it's going to help the local economy? We talked about the massive amounts of money that goes towards the unhealed wounds every year.
So, you know, it's really time for the policymaker in Kuwait. Kuwait is the first, and Kuwait is the last. I'm a very strong nationalist, and we really need to move away, not to think about moving away from the oil economy, based, oil-based economy. We really need to start not thinking about it, but really doing something about it. We have great people around us. We teach in the Faculty of Medicine. I see people at the Desman Diabetes Institute. We have very smart people. It's time now to regain the economy,
of course,
change it, and make it a pharmaceutical-based economy. $20 billion is spent annually on wound healing, and they cannot do it. That 20 billion can come to Kuwait.
Right.
Okay?
Right.
12 drugs in the USA generate $100 billion. More than oil can generate in all the countries. 100 billion a year.
Yes.
Think about it. One invention like that in Kuwait can replace the oil-based economy. Policymakers should now not think about, I have to repeat it, not think about doing it, but really do it and support us.
Right, actually take a step.
Absolutely. That's how we're going to change the economy. Okay?
Yes.
This is a very important point, I think. Yes.
I agree with you. Of course, I'm very glad you mentioned everything you did during this interview, because it could be helpful to so many people, not just in Kuwait, around the world. Is there anything else you would like to add before we end this interview?
Sure.
I think we like to thank Professor Adnan Shihabuddin at KFAS for his enormous support, and also I like to thank the University of Kuwait Research Administration also for their kind support for the generation of those patents.
Yes.
Similarly, really I would like to acknowledge the effort of Professor Hilal Al-Sayer and the Minister of Health, Dr. Basil Sabah, for all their support to DDI. DDI is becoming, Desman Institute is becoming really supported by the Ministry of Health, and we love this because we want to help the patients.
Of course.
And so particularly I would like to thank the leader of Desman Diabetes Institute, who really took this institute from, I wouldn't say failed institute, but not an institute that was not doing very well.
Not a very strong one.
To one that is recognized currently internationally in 2 years. If there's anything, Dr. Qais Al-Duwairi has proven himself as a great leader.
Amazing.
In everybody's eyes, especially mine. So I thank them all for their leadership, really.
Thank you very much. And of course, I thank you, Professor Milad and Professor Fahd, for being with us today.
Thank you.
Thank you very
so
much. Thank you.
Thank you. We had with us Professor Milad Sami Bitar, a professor of pharmacology and therapeutics at Kuwait University, Faculty of Medicine, consultant at Desman Diabetes Institute. And of course, Professor Fahd Al-Mulla, a professor of genomic medicine, chief scientific officer at Desman Diabetes Institute. And now we're going to cut to our next report for this evening on the informative symposium on the Arab Government Excellence Awards. Stay tuned.